Health AI turns permissions and simulation into the product. OpenAI's connected health rollout and NVIDIA's open medical robotics simulation framework show AI moving into consequential, deeply contextual systems where consent, reproducibility, edge case testing, and human escalation are inseparable from capability. The evening's clearest technology signal is not a new leaderboard result. It is AI moving closer to the private records, physical environments, and high-consequence decisions that shape people's lives. OpenAI is bringing connected health information into ChatGPT, while NVIDIA has released an open-source medical physics simulation framework for training and testing healthcare robots. One system is trying to reason across a person's history, the other is trying to reproduce the physical variability of anatomy, instruments, sensors, and failure cases. Both point to the same conclusion. In consequential AI, the surrounding operating contract is part of the intelligence. OpenAI says health in ChatGPT is launching to logged-in US users age 18 and older across web and iOS. With permission, users can connect Apple Health and supported medical records so the assistant can compare new results with prior tests, summarize changes since an appointment, or relate sleep and activity to a broader routine. OpenAI says more than 300 million people ask ChatGPT health-related questions each week, and that over 70% of health conversations among early users occurred outside the dedicated health area. The product response is to make health context available across conversations while keeping a central place to connect, inspect, and manage it. That convenience raises the standard for permission design. OpenAI says connected medical records, Apple Health information, and conversations using that data are not used to train foundation models or target ads. By default, ChatGPT asks before using connected health information, and users can approve once, allow ongoing access, disconnect sources, use temporary chat, or manage memory separately. The company also says additional safeguards apply before another connected plugin could disclose health-derived information. Those controls matter because health context is useful precisely when it crosses ordinary life boundaries: food, travel, exercise, family plans, and that is also where accidental overreach becomes easiest. The medical limit remains explicit. OpenAI says ChatGPT can make mistakes and does not replace qualified professional care. It reports working with hundreds of physicians on evaluations covering accuracy, safety, communication, context awareness, completeness, and appropriate escalation. The important product question is therefore not whether an assistant can sound medically fluent. It is whether it can recognize missing context, communicate uncertainty, preserve the original source, and direct a person toward professional judgment when the stakes exceed the system's role. NVIDIA's medical physics simulation framework attacks a different bottleneck. Healthcare robots need experience with anatomy-device contact, friction, flexible instruments, noisy imaging, and rare failure scenarios, but those cases are costly or impossible to collect on demand. The open-source, GPU-accelerated framework within Isaac for healthcare combines anatomy, device behavior, sensor simulation, and robot learning, so teams can build reusable virtual environments and test policies before hardware-heavy trials. NVIDIA reports that the framework can run hundreds of parallel environments and cites a benchmark in which 8192 robot training environments reduced a training workload from more than 5 hours to under 2 minutes. It supports combinations such as vascular anatomy, catheters or guidewires, simulated X-ray imaging, and reinforcement learning. Industry collaborators are applying related tools to soft tissue procedures, endoluminal robotics, catheter navigation, device mechanics, and evidence for regulatory pathways. These are vendor-reported examples, not proof that a simulated result transfers safely into every clinical setting, but they show why simulation is becoming core infrastructure for physical AI. Open source is especially consequential here. Inspectable frameworks, models, weights, reference workflows, and benchmarks can help teams reproduce results, test different anatomies, identify limits, and assemble evidence for review. Openness does not remove the need for validation, security, or clinical governance. It makes more of the reasoning surface available for challenge. In a field where rare edge cases may determine safety, the ability to ask exactly what was simulated, what was omitted, and whether another team can reproduce the result is a practical advantage. First-hand engineering work during this reporting period reinforced the same systems lesson in a lower-stakes setting. A restaurant website and connected point-of-sale demonstration were restored as separate but coordinated experiences. The public presentation regained its intended visual identity, while online ordering continued to use the same live menu and local checkout path as the staff system. Desktop and mobile views were checked, a controlled order was traced into the point-of-sale workflow, and the test state was cleaned up afterward. The useful outcome was not merely that two screens looked correct. It was proof that presentation, shared data, transaction flow, and operational cleanup still agreed. Some paths required recovery rather than reinvention. Existing assets and working integrations were preserved, a recovery archive was created before deployment, and verification caught the kinds of boundary errors that a screenshot alone would miss. Elsewhere in the publication system, transient infrastructure and media path issues were treated as discovery and repair work instead of justification to shorten the promised result. The lesson is consistent across restaurant software, public media, and health AI. Preserve the canonical source, test the actual boundary crossing, and repair only the failing layer. The practical implications are direct. Health AI builders should make per-use consent, provenance, source. My perspective is that technology is entering an accountability phase. Models will keep becoming more capable, but the systems that earn durable trust will be those that can show where context came from, why it was used, what uncertainty remains, and how a person can interrupt or challenge the result. In health, this is an ethical necessity. In business software, it is the difference between a polished demo and a dependable operation. In public AI media, it is the difference between generating artifacts and preserving one verifiable meaning across them. The direction of the world is therefore not simply toward more automation. It is toward environments in which simulation, memory, permissions, and verification determine which automation can safely become ordinary. The best systems will use AI to make complex information and physical behavior more understandable without erasing professional judgment or human agency. Capability gets attention. An inspectable operating contract is what lets capability stay. Sources reviewed: OpenAI launching health in ChatGPT, July 23, 2026. https openai.com/index/health-and-chat/. NVIDIA blog: NVIDIA open sources first GPU-accelerated medical physics simulation framework. July 22, 2026. https://blog.nvidia.com/medical-physics-simulation-open-source/. NVIDIA Isaac for healthcare medical physics simulation documentation. https://isaac-for-healthcare.github.io/medical-physics-simulation/.